Open heart surgery. It could be one of the most difficult experiences anyone could go through. But there is some good news. The U.S. Food and Drug Administration recently approved a minimally invasive alternative to open heart surgery. Joining us now with all the details is cardiac surgeon Dr. Michael Reardon. Dr. Reardon, thank you for joining us. Let's get right into it. What is heart valve disease and how many people does it actually impact?
Well, the heart has 4 valves and they control the flow of blood through the heart. The one that lets the blood out, the aortic valve, which we're talking about today, when it becomes narrow, puts a strain on the heart and can cause a risk of death of up to 1% per month when severe. This can affect hundreds of thousands of people in the U.S. and millions of people worldwide.
So could you tell us more about this less invasive treatment option?
When the aortic valve becomes severely narrowed or stenotic and you become symptomatic, if we don't replace that valve, it's a risk to you. Up until recently, the only option was open surgery, where we opened your chest, stopped your heart, and replaced the valve. Transcatheter valve replacement allows us to go up through the leg without opening your chest and without stopping your heart. The valve we're talking about today, the Evolut valve, has a frame made out of a compressible metal called nitinol that has a quality like a spring where it'll go back to its original shape, and a tissue valve inside. This allows us to compress it small enough to go through your leg artery, over a wire, all the way up to replace your native aortic valve.
What are the benefits and risks of this procedure as compared to open heart surgery?
Well, since I don't have to put you to sleep, and since I don't have to open your chest, I don't have to stop your heart, it's clearly much less invasive. It tends to be faster. We usually don't go to an ICU but to a recovery room, so you're with your family the afternoon of your procedure. You're usually home in about 2 days, and within a week you're usually back to normal activity. There's less chance of you dying during this procedure, less chance of you having a stroke, and you have less chance of kidney injury and bleeding. So it's clearly a safer procedure.
What does the recent FDA approval mean for patients?
Well, we started with high-risk patients, then went to intermediate, and now have tested against low-risk patients, and this valve has shown itself to be a good alternative to surgery in all risk strata. Now, the low-risk patients is the largest group of patients that have yet to be treated with this, so this opens up this as a possibility for a far larger group of patients.
Doctor, thank you. Where can we go for more information?
Well, first of all, you can go to your local physician. They should help you with this, but there's a website called ytavr.com where you can go for additional information.
For more information on this less invasive treatment option, head over to the website right there on your screen. Medtronic is a proud sponsor of Las Vegas Morning Blend.